Hello, today in this video we are going to see the right atrium. In this diagram, the first diagram, you are seeing the sternocostal surface of the heart. Let us see the structure seen. We have the right atrium, the right ventricle, left ventricle, superior vena cava, inferior vena cava, ascending aorta, and the pulmonary trunk. Pulmonary trunk. Okay, the right atrium is an vertically elongated chamber which forms the part of sternocostal surface, and it also forms the part of right border. This is the right border of the heart. You can see the right border of the heart. It receives superior vena cava at the upper end and inferior vena cava at the lower end. And along the right margin of this particular right atrium, there is a sulcus. A sulcus is seen. That sulcus is known as the sulcus terminalis. Sulcus terminalis. Terminalis. Remember, sulcus terminalis. So sulcus terminalis is present along the right border of the heart, extending from the superior vena cava and the inferior vena cava. Okay, so here in the other diagram you are seeing the posterior surface of the heart, where you can see the left atrium, and here you see right atrium. So here the right atrium is clearly seen. The superior vena cava opens at the upper part of the right atrium and the inferior vena cava to the lower part of the right atrium. Okay, then so this right atrium has got a small prolongation towards the left part, so that is known as the right auricle. Right auricle, and the right auricle which is present, it is located, or it is directed towards the left side, left part of the towards left, and it is over the ascending aorta and the pulmonary trunk. Okay, starting point of the pulmonary trunk. So here you are seeing the interior of the right atrium, interior of the right atrium. You can see here again we have the superior vena cava, here we have the inferior vena cava. Okay, along the right border of the heart, extending from the superior vena cava to inferior cava, there is a muscular ridge internally, that is known as a crista terminalis. We have already seen that there is a sulcus present, sulcus terminalis, sulcus terminalis. It is present along the right border. The sulcus terminalis is produced by internal muscular ridge, that is known as the cristae terminalis. Cristae terminalis. Remember this, usually asked for examination. Sulcus terminalis is internally produced by the cristae terminalis. Okay, then this interior of the right atrium, so you can see interior of right atrium can be divided into two parts. Okay, two walls or two parts, that is smooth posterior part, smooth posterior part, and rough anterior part, rough anterior part. Okay, that means the area in front of this crista terminalis is rough part, and area behind this crista terminalis is the smooth part. Then the why anterior part is rough. So you can see from this crista terminalis there arises so many muscular ridges are there. These muscular ridges, comb-like muscular ridges, arises from this crista terminalis. So these muscular ridges are known as the musculae pectinate. Musculae pectinate. Musculae pectinate. So because of the musculae pectinate, the anterior part is rough. Anterior part is rough. Okay, there is no such structures on the posterior part. That is why the posterior part is smooth. Now between the right atrium and left atrium, so there is interatrial septum. We have interatrial septum. So interatrial septum is present between the right atrium and left atrium. For example, if we draw like this, a diagram like this, so we have the right atrium here, and this is the left atrium. Okay, right atrium and left atrium. So this is the interatrial septum. Okay, the interatrial septum. So here actually you are seeing the interatrial. This is the interatrial septum. Okay, the interatrial septum presents a depression, saucer shaped depression. That depression is known as the fossa ovalis. Fossa ovalis. Fossa ovalis. So the interatrial septum has got a depression here. So that depression is known as the, these are the ventricles, right ventricle, left ventricle. Okay, so this is known as the fossa ovalis. Fossa ovalis. What exactly the fossa ovalis? Fossa ovalis, this particular fossa ovalis represents the embryological foramen ovale. Foramen ovale. Foramen ovale. Okay, what happens during embryonic life? Okay, there is a foramen. There is a foramen. So that foramen is known as the foramen ovale. Okay, so what is the function of this foramen ovale? So foramen ovale, bypasses the blood from the right atrium to the left atrium in fetal life. In fetal life. Okay, remember there is a foramen. That foramen is known as the foramen ovale. Now again in this diagram you can see here we have the superior vena cava. This is the superior vena cava. Here we have the inferior vena cava. Okay, and what was the name of this area? This is the sulcus terminalis. Sulcus terminalis. Okay, it is produced by the crista terminalis. Okay, at the upper part of the sulcus terminalis, or between the sulcus terminalis and the opening of the superior vena cava, there is a structure. That structure you know, that is known as the SA node. SA node. Remember, SA node is situated in this area. So here we have the SA node. Okay, now you can see the interior. Can you identify the structure? That is the, again, foramen, sorry, fossa ovalis. Fossa ovalis here. Okay, now let us discuss the openings of right atrium. Openings of right atrium. What are the openings of right atrium? You can see superior vena cava opens at the upper end. Then we have the inferior vena cava opens at the lower end. Remember, opening of inferior vena cava, opening of inferior vena cava is guarded by the valve. There is a valve that is known as the Eustachian valve. Remember this one, Eustachian valve. What is the function of this Eustachian valve? Eustachian valve, I told you, which directs blood to left atrium during fetal life. I told you at this fossa ovalis there was a foramen. This foramen bypasses the blood from the right atrium to the left atrium. Okay, so that is the function. That means this Eustachian tube directs the blood from the inferior to the blood of the inferior vena cava to the left atrium. That is function of this Eustachian tube. Again, you are seeing one more opening here. Okay, this is the opening of coronary sinus. What is coronary sinus? Coronary sinus. Coronary sinus, as we know, it is the largest vein of heart. That is a coronary sinus. So here is a coronary sinus, opening of the coronary sinus. Where you can see opening of the coronary sinus. Coronary sinus opens into the right atrium in between the opening of inferior vena cava, and this is a tricuspid orifice. Tricuspid orifice. Tricuspid orifice. Okay, so that is in between the opening of the inferior vena cava and tricuspid orifice. We can see the opening of coronary sinus. Now we have already seen that this is the foramen ovale. Foramen ovale. The foramen ovale has got a margin. You know this margin. So that is known as the limbus fossae ovalis. Limbus fossa ovalis or annulus fossa ovalis. Annulus fossa ovalis. So the limbus fossa ovalis and annulus fossa ovalis. The limbus fossa ovalis or the annulus fossa ovalis is a deficient inferiorly. If you see here, it is deficient here, and this particular part is continuous with the left end of the valve of inferior vena cava. This is the valve of inferior vena cava. Left end of the valve of inferior vena cava. Now you can see this particular part is the right auricle. Okay, you can see interior of the right auricle also is rough. There also we can see some muscular ridges are there. So this rough right auricle prevents the free flow of blood and thus favors the formation of thrombus. There may be the formation of thrombus. That is the rough interior of right auricle. Right auricle favors thrombus formation. So thrombus may get formed here. Okay, this thrombus may dislodge during auricular fibrillations and may go to this systemic circulation. Then it can go to the pulmonary circulation, and it may produce embolism in lungs. That is called pulmonary embolism. It may produce, that means, so because of this roughness of the right auricle, okay, so there may be a chance for the formation of thrombus. If the thrombus get formed inside this area, this may go into this pulmonary circulation, okay, and it may create pulmonary embolism. Now there is a new term or topic that is called triangle of Koch, usually asked for examinations. What do you mean by triangle of Koch? So triangle of Koch is a triangular area which is bounded by three structures. Okay, so here you can see, before that you can see the tricuspid valve. Okay, this is the coronary sinus. Okay, and here see fossa valis. Okay, this particular area is known as the triangle of Koch, which is bounded. Triangle of Koch is bounded by the septal leaflet of the tricuspid. This is the leaflet of the tricuspid valve. Okay, septal leaflet of the tricuspid valve. Septal leaflet of tricuspid valve. First bound. Second one, tricuspid valve, and there is this is the coronary sinus, anterior margin of the coronary sinus, opening of the coronary sinus, coronary sinus, and posteriorly by there is an elevation structure that is known as the tendon of Todaro. What is tendon of Todaro? It's a subendocardial ridge. There is a ridge. That subendocardial ridge is known as the tendon of Todaro. What is the importance of this triangular Koch? That is, AV node is situated here. AV node is located in this triangle of Koch. Remember this one, AV node is present. Here we have the AV node is present in the triangle of Koch.